Okay, let's move on now to our next speaker, who is Dr. Wayne Greaves. I'm talking about cancer risk factors. Wayne is a Harazonian as well and went on to McGill University for medical school and did pharmacology and his residency there at McGill as well. Before going down to Vanderbilt University, where he studied infectious diseases. After that, he had a stint at the CDC and went on to Harvard University, where he spent many years as chief of HIV um, clinic there, and he's contributed greatly to the literature back then in the early days, and was even awarded a presidential medal. Was it a medal? A presidential award for his work in HIV care. Wayne is currently Distinguished Scientist and Executive Director at Merck Research Laboratories. He's an avid researcher in terms of viral drug development. Is drug development for viral diseases, and also he's a great teacher, and I think you'll enjoy this presentation today as he talks about risk factors for cancer. He's also avid, like Dr. Barling, he's an avid promoter of equity in healthcare, especially cancer care. And he's out there doing his bit for the community in terms of education and mentoring. And great photographer, great cyclist. Welcome. Uh, the floor is yours.
Okay. Thanks, O'Neill, and for the invitation. Before I start, I really must commend Dr. Barling. You know, if I listened to you much longer, I'd want to switch my specialty and become an oncologist. It was so good. So thank you so much for that.
Thank you.
I'm going to be speaking a little bit more simply. I'm going to be talking about risk factors in general for cancer. And I'll go through pretty quickly some of what I'd say it's been touched on at least, but I'm more taking a broader view so we can see how things go. So the first point I'd make is that, you know, we'd all like to avoid cancer, of course. We like to know what the risk factors are, and we know what the risk factors are for some cancers, but not all cancers. So we'll look at a few of these. Most cancers are caused by a mix of factors, though, and these factors can be divided basically into some that are modifiable, things like lifestyle behaviors or exposure to various toxins, and others are not modifiable. And here we're thinking of things that are more driven by age or by genetics. And I just show here some of the modifiable risk factors are things like diet, physical activity levels, toxic exposures, lifestyle, cigarette smoking, alcohol consumption, immune health, and stress levels. So first I'll talk about tobacco use. And this is common knowledge, but cigarettes, cigars, smoking tobacco. And the evidence is very, very strong, although the companies for many, many years hid the data, but it's become very, very clear. There's a definite association with tobacco use in many of these cancers that I show here: lung, oral cavity, larynx, esophagus, bladder, pancreas, kidney, cervix, and others. And what we know is that any level of tobacco use seems to increase the risk, but the intensity is what drives it even more so, as well as the duration. And of course, the way to approach this is don't start, if you do smoke, to quit. Alcohol is another common factor that we encounter. And here again, the evidence is very good, and it shows that there's a dose-dependent relationship to alcohol, to the point where now we're saying that there doesn't seem to be any safe dose of alcohol in terms of its ability to cause cancer. And there was a time when I don't want to say idolize it, but it made it seem as though drinking was not such a bad thing, at least moderate drinking, often portrayed as harmless or even good for your health. But over time, in the last few decades, growing research has linked alcohol use to at least 7 types of cancer, which you can see on the right. And in some cases, even less than 1 drink per day can cause the risk. And here we're looking at oral cavity, the mouth, throat, voice, larynx, esophagus, breast, liver, colon, and rectum, and there's even some association to a lesser extent with bladder, but these are the main ones, these 7 types of cancer. So what about weight? Being overweight or obese? There's also evidence for this association with many cancers, not all cancers, But the ones that seem to be most strongly associated are endometrium, breast if you're postmenopausal, colorectal, pancreas, and adenocarcinoma of the esophagus, kidney, and a few others. Risk seems to increase with the higher the BMI and with central adiposity, or the weight around the belly as opposed to other parts of the body. Again, to attempt to deal with this risk factor is to aim for a healthy weight through balanced diet and regular physical activity. I know this is something that we talk about a lot, but of course it's easier to say than to do, but this is the goal. I'm glad that you heard about the importance of exercise. I think people tend to gravitate to thinking more it's what I eat that will cause cancer or what I don't eat. But actually, the stronger evidence that's been emerging is more for exercise as an approach that one can take to minimize or prevent some cancers, or at least mitigate the impact of some cancers. So exercise, in my opinion, based on all the research data, is a much more potent approach to embark upon or take up as opposed to diet. But diet has an important role to play as well, so I don't want to knock it out completely. So physical inactivity is strongly associated with these particular cancers I show here: colorectal, breast, endometrial, and possibly some others. Now, the recommendation is generally in terms of exercise to aim for 150 minutes per week of moderate intensity exercise, or 75 minutes per week of vigorous activity, plus strength training twice weekly. I'd say if you can't do all of this, do something. It's better to do some exercise than nothing at all and not just be a couch potato. And there are many types of diets that are unhealthy. We know that there's an association with high processed foods like red meat and so on, and some benefit from things like low fruits, vegetables, and a plant-based diet, which we probably don't have time to get into, but which is really assuming more and more importance. The evidence here for unhealthy diets is perhaps best for colorectal cancer, where processed meat has been implicated, but possibly for stomach as well and others. So one approach to address this is to work on developing or using or eating a mostly plant-based diet. Don't have to be vegan or vegetarian, but at least move towards being more and more plant-based, because there are many, many benefits to be gained by following a plant-based diet. We don't have time to go into details, but just take my word for it. Now, because I'm heavily involved in infectious diseases, this is of particular interest to me. There are a number of infections that are associated with cancer. And here are the ones that I'm focusing on. Human papillomavirus, which has been associated with cervical cancer, but also with anal cancer, particularly homosexual men, or pharyngeal cancer. And then there's hepatitis B and C, which can cause liver cancer. We also know that Helicobacter pylori has been associated with stomach cancer, and Epstein-Barr virus, which is a virus that also causes mononucleosis, but it has been linked to some lymphomas and nasopharyngeal cancers. And then there's human herpes virus type 8, which has been associated with Kaposi sarcoma, which is a rare disease, cancer. We saw it really a lot in gay men early on in the AIDS epidemic, and really came to the forefront. And all of that research led to our finding the association between human herpes and virus. But it can occur apart from HIV as well. And I didn't mention HIV, but HIV itself, because it's affecting the immune system, has been associated with increased risk of a number of cancers. And this just shows you more graphically the most common infection-related cancers worldwide, showing the stomach, the cervix, the liver, head and neck, anogenital areas. These are the major areas that are affected by cancers caused by infectious agents. Then there's ionizing radiation. We're getting better now at making CT machines that don't really deliver as much radiation, or doesn't scatter as much. But excessive CT scans can be an issue. This isn't an issue for most people because you don't have that many scans, but just to be aware of this. Radon exposure in the home, which you probably know about. And then there are other kinds of occupational exposures, which I won't go into right now. The kinds of cancers that emerge after exposure to radiation, high levels, are things like leukemias, thyroid, lung, breast, maybe a few others. But leukemias and thyroid, and then lung, those are the ones that I'd put at the top. So we want to reduce unnecessary medical imaging, particularly CT scans, not MRI scans in this case, but CT-driven scans are the ones that we'd worry about. And you might also pay attention just because even your dentists now, they're using more and more CT scans. So it's not just, medical scanning where you go lie in a tube, but dentists are often using now a lot more CT scans. But as I said, they're now moving towards green scanning, meaning that they're a little bit less toxic in terms of radiation. So that's a good thing. Ultraviolet radiation, the sun, excessive sun exposure is not necessarily a good thing. And it's great for vitamin D, but it can be overdone, particularly when you're exposed to the sun in the middle of the day or from between 10 a.m. and 2 p.m. Very, very intense exposure, particularly if you're in the tropics, Caribbean, for example. This is a big risk. And I always remember the case of Bob Marley with melanoma, melanoma is a very tricky cancer. You can see that the cancers that are associated with UV radiation are basal cell carcinoma, squamous cell carcinoma, and melanoma. Melanoma can be deadly, very difficult to treat, hard to detect sometimes because it can be hidden in places where you don't necessarily see it. And it can be very small when it starts, but it can spread fairly easily, and it's not the easiest cancer to treat. We're, of course, developing newer and better drugs for this, but it's still an issue. So it's important to be aware of this as a potential risk factor from excessive sun exposure, particularly starting at an early age. That seems to be one of the key factors. Then there are occupational carcinogens and air pollution. Occupational carcinogens, years ago, we realized that exposure to asbestos, people ripping up ceilings and places where their insulation, where they're exposed to asbestos, develop specific kinds of lung cancers like mesotheliomas. Then there's benzene exposure being associated with leukemia, and a number of other industrial toxins, including things like diesel exhaust, although air pollution, which I won't say much more about. The big one here, I think, that really came to the forefront that made us become very aware of this sort of things. Asbestos was a big one in benzene products. Then there are other exposures even in the workplace. People who work with carcinogenic agents like formaldehyde and many others, they need to be aware that there are risks to being exposed to some of these toxic things, paint strippers, so on the right. So let's now just skip quickly to the non-modifiable risk factors. I talked about age as the single strongest overall risk factor. Most cancers tend to occur in older adults. As we get older, our immune systems aren't as good at detecting foreign antigens and tumors and dealing with them, or NK cells and other important cells in the immune system aren't as effective. It's also important to pay attention to family history and various inherited gene variants. You heard about a number of them. I'll just mention a couple of them quickly here. The big ones, of course, particularly for breast, and also to a lesser extent now, but important, BRCA1 and BRCA2, but BRCA2 has become also very important for men with prostate cancer. It's usually the kind of cancer that doesn't respond as well to things like radiation. Often people are promoting surgery for BRCA2, even though the outcome of treatment of prostate cancer for radiation therapy and surgical therapy today is about the same. Advances in radiology have really been incredible, radiation therapy. But these are things to know about, and it's useful to be able to be tested, and then you can talk to your family members. For example, if a man has BRCA2 gene, it's important that if they have other members of the family, particularly sons, that they be tested earlier and not the routine age like 45 or 50 for prostate cancer, but start to test earlier, even at age 40. So genetic understanding and testing and counseling are important for several kinds of cancers. And at the top of the list will be breast, ovarian, and prostate, in my mind. Colorectal and endometrial are also listed here, but I haven't seen them to be quite as common. Lynch syndrome is a particular rare syndrome, but also associated with some of these abnormal gene mutations. And then there are other important risks in terms of reproductive and hormonal factors, things that you can't really do much about. But you had early menarche or late menopause, women who are nulliparous, exposure to combined hormone replacement therapy, although that's getting better and not as definite a risk factors before. But again, screening can be important for these cancers that put you at risk, these conditions that put you at risk for these cancers. HPV testing for cervical cancer, we talked about mammography and other tests for breast cancer, colorectal, stool-based tests and colonoscopy, and so on, and now low-dose CT for lung cancer, particularly in former heavy smokers or current smokers. So I think this is my last slide. Best ways to reduce cancer risk: stay away from tobacco, secondhand smoke, alcohol. Try to maintain a healthy weight, stay physically active, don't be a couch potato, protect the skin from UV radiation, avoid things like tanning beds, get your vaccinations for human papillomavirus, hepatitis B, any infections that might put you at risk, like Helicobacter pylori for gastric cancer, and follow screening recommendations and limit unnecessary radiation exposure. Talk to your physicians and whoever if you really need to have the specific scans or tests that you need. And if you work in settings where there's environmental exposure, be aware of this and take the necessary precautions. And on that note, I think I will pass you back to the moderators. Thank you.
Excellent. Thanks very much.